So integrating trainees into the response to disasters. So you can see many of us have mentioned part of this is when we're looking at all these disasters, when we're MIS, it's really important that the whole team knows what's happening. Oh, sorry, disclosures. I'm a proctor for Intuitive, won't be relevant to the talk. So I would say one of our most important tasks is training this next generation of robotic surgeons or MIS surgeons. And converting in an emergency situation requires all the team members know what to do at that second. And so we can't let it go until this happens to train them, on the next steps. It's challenging because our trainees are always changing, right? So we may have them for a month or maybe 2 months if you're lucky. They might be at different locations in the room. So if you're doing a robotic operation, maybe they're at the console with you or maybe they're at the bedside with you. And so their roles are always changing. So getting them to know what to do at the right second is really important. And so this is especially important in MIS hepatobiliary surgery because as you can see, we can cause lots of disasters. So this is my most important thing to tell us is that this is all easy to practice. So these situations we can emulate in labs, we can practice, we can go over the steps. And so that's the most important thing for our trainees is that we need to show them what to do before these situations arise. So during the timeout, I think that doing your normal timeout per your institution is really important. But then after that, doing this a robot emergency timeout is really helpful. So develop a checklist for your institution, basically reviewing very quickly what everyone does in the room, and I'll go over kind of the individual's responsibilities. And then during the case, I like to address the what ifs with the trainee pretty routinely. So when we're operating and everything's mundane and everything's fine, I like to ask them, like when you see the middle hepatic vein, ask them, hey, what would you do right now if we caused bleeding in the middle hepatic vein? Or if you're doing a Whipple and you're coming up the uncinate, all right, what would you do? So just make this like a routine part of your training for your fellows and residents. So for emergency conversion process, I love this figure because it looks messy because that's often what it seems like in the room, right? Like it seems a little chaotic during an emergency conversion, and you want to do everything in your power to make it not seem chaotic, but all these things should happen at once, right? So surgeon in the middle decides to convert and communicates that decision to convert, and then everyone else needs to know what to do. The scrub needs to know to open the instruments. The circulating nurse needs to make sure all those instruments are there and ready. The bedside assistant needs to know to not pull all the instruments out and to hold pressure or keep the robot arm in place. The anesthesiologist needs to know to call for massive transfusion if you need it. So all these things need to happen at once. So this is a paper written by one of my thoracic colleagues at Ohio State, and this is for MIS or robot. And this really applies across the board regardless of what operation you're going to do. And it really breaks down for every person in the room our priorities, our first priority, our second priority, third priority. And the red there, we'll go over a little bit more, but in the red there are specific to robot and all the others are MIS. So if we look here, if we start breaking down the surgeon and first assistant, so this is where you start thinking about your trainees. If you're doing a robot procedure and your trainees at the bedside, they need to know that these are their jobs. So confirm, before you go pulling all the instruments out, confirm what stays and what goes. Leave the camera in. And then second priority, ensure, everything else is getting set up, the Bovie's getting passed off, et cetera. And then help the scrub to get everything else ready. And surgeon responsibilities, we usually kind of know our responsibilities, and that's not but our job, like many have said, we have to communicate what we're doing and what we see. So if you see bleeding and there's going to be, you need to communicate to the anesthesiologist that, hey, I need blood, I have real bleeding this time. So that's probably the most important part in that first priority. Try to control the bleeding yourself, of course, and in doc as necessary. And then our second and third priorities, of course, are go scrub and gown, et cetera. And then everybody else, same thing. So all the people in the room need to know what they're doing at that point. So this is a nice, if you're going to make checklists for the rest of your staff, this is a nice thing to base it off of. So what does the circulator need to be thinking about and doing? And I would add to that circulators first priority, in addition to getting other people and activating code, but making sure all the equipment has been open. So did you have open equipment already open? Do you need it open? So you can see all the rest of the people, the kind of what are our priorities. And then for our anesthesiologists, of course, need to communicate back with you how the patient's doing, start resuscitation, and call other help if they need it, and assess access, et cetera. All this can be done and simulated, right? So I don't think this shouldn't be the first time your trainees have seen it happen in the operating room. So if you're doing an animal lab with them and you're doing a pig lab and you've done whatever activities you were going to do for the day, have a robotic conversion at the end of it. Either make bleeding or just pretend there's bleeding, assign people roles, and make sure they know what they're doing. So they should be able to tell you all the roles of everybody in the room, because they're going to have to command that room at some point. So practice this. Make checklists for them, or help your institution make checklists if you need to. And then review these basics with the trainees early and often. So in conclusion, you're training your team is well worth your investment of your time if you ever need to do an emergent conversion. Urgent conversion should be rare, but this can be practiced. And I would argue this is one of the most critical things we can do in training our fellows and residents. Thank you.
Thank you so much.